Hi. So the patient in this case study is a 25-year-old male who experienced a severe motorcycle accident that resulted in a traumatic brain injury and a right upper extremity shoulder disarticulation amputation. After the accident, the patient experienced respiratory arrest and required CPR and sustained an anoxic brain injury. He also underwent multiple surgeries, including abdominal surgery, wound debridement, skin grafting, and the amputation procedure. Prior to the injury, the patient was fully independent, worked full time as a mechanic, and completed all mobility and daily activities without assistance. However, after the accident, he now presents with significant impairments in balance, coordination, cognition, safety awareness, and functional mobility. He demonstrates impulsive behavior, distractibility, impaired attention, poor insight, and short-term memory deficits, which are consistent with Rancho Los Amigos levels 5 to 6. From a physical therapy perspective, the patient demonstrates gait instability, impaired balance, poor posture, and difficulty with transfers and mobility tasks. During ambulation, he presents with a narrow base of support, scissoring gait pattern, lateral sway, and poor safety awareness, requiring assistance for safe walking. Stairs are currently unsafe due to impaired balance and body awareness. In addition, the patient reports severe phantom limb pain at the amputation site. There are several contextual factors that may impact the patient's rehabilitation process. First are the personal factors. The patient is young, which may positively influence recovery and neuroplasticity. However, he also has a history of depression, anxiety, and drug addiction, which may negatively impact motivation, emotional adjustment, participation in therapy, and long-term compliance with the treatment. In addition, the patient is coping with the sudden loss of his dominant upper extremity, which can affect body image, independence, and emotional well-being. Environmental factors are also important. The patient currently lives with his mother in a single-level home, which provides support and supervision. However, there are 12 stairs with only one handrail at the entrance of the home, creating a significant fall risk due to the patient's impaired balance and impulsivity. Psychosocial factors also play a large role in this case. The patient demonstrates confusion, impaired judgment, and distractibility from the traumatic brain injury, which can increase caregiver burden and safety concerns. The patient may also experience frustration, grief, anxiety, or depression related to his injuries and lifestyle changes. One recommendation I would make to improve the patient's safety and accessibility would be adding bilateral handrails and improving stair safety at the entrance of the home. Since the patient currently has impaired balance and poor safety awareness, this would help reduce fall risk and improve safety during home entry and exit. Removing clutter and creating clear walking pathways inside the home would also help improve mobility safety. One community resource I would recommend is the Brain Injury Association of America, also known as the BIAA. This organization provides education, support groups, caregiver resources, rehabilitation information, and community support for individuals with traumatic brain injuries and their families. They also provide emotional support and help connect families with vocational and rehabilitation resources that may assist with long-term recovery and community reintegration. Thank you so much.